Radiation Therapy Program Director here at VCU, and I want to show you our new classroom and talk to you a little bit about what a radiation therapist does on a day-to-day basis. So this newest piece of equipment we have is called Vert, short for virtual. So we are virtually looking at what a radiation therapy machine looks like and all of its capabilities. So here is a linear accelerator. So this is where the radiation comes out to treat the patient. I'm just representing a small radiation beam here, but you can see that it's coming out of here. I can also rotate it around in the room to show you the different perspectives. This is typically how a patient would lay on the table. We usually have it close off, but this is just showing you the basic premise. So the patient's laying there with something under their head, arms by their sides, and I can show you how the beam is oriented. I can also turn the lasers on and off that we would see in the room. I can turn the room lights on and off. I can turn what we call the SSD light on, the field light on, so that when I zoom in on the patient, I can show you exactly how we would be setting this patient up on a day-to-day basis. And I can teach that to the students, their skills before they ever enter the clinic, okay? The other thing that's nice about this piece of software is it's not just software, it's also hardware. So the student can also take the actual pendant that they're going to be using in the treatment room, and we can actually move the machine. I'm going to move what's called the gantry around the patient. I can also move the table up and down. And so they get a very good sense of how it's going to be when they actually enter the clinic. And so we're actually able to grade them on their performance prior to actually entering the clinic. So that's new and wonderful for us. The other thing I can do is I can incorporate a CT data set here. And so you can see that I have a CT data set that's moving in and out, up and down the patient. But what's nice is we can actually go inside of the patient. And I can show you exactly what kind of, we can look at anatomy. So here's the spine and the spinal cord and the lung. And I can turn different contours on and off. And I can turn different surfaces on and off. So I can turn on what we're trying to treat, what we're trying to avoid. I can turn the dose on and off. So here I'm just going to look at CT anatomy. And I can again move that up and down the patient. Or I can also turn on the dose that's going to be delivered to that patient. And I can limit that to the area that we're interested in. And so you can see here that we are treating something in this area. It's called a thymoma. But we're limiting the dose to the area of interest, and we're not treating things like most of the lung or the spinal cord. So we're able to transfer actual treatment plans into this system so we can talk about the ramifications to our students. Now if we back up and just look at it from a broad view, every patient is going to be a little bit different. So this is just a patient, and I showed you a thymoma. She happens to be supine with her arms down by her side. Other patients have many different what we call immobilization devices to help them stay in a particular position. So I'm going to show you some of the things we have in the room. So if we wanted to treat someone's pelvis, for instance, we might place them on what's called a backlog bag. And that would rest under the patient. It would be form-fitting, and then we would evacuate the air out of here. This currently feels like a beanbag chair. But once I evacuate the extra air out of it, it becomes hard and stiff, and it would stick with the patient for all of their treatments. And so again, radiation therapy treatments are usually anywhere from 3 to 5 weeks. So the patient comes in on a day-to-day basis, spends 10 to 15 minutes with us, or sometimes longer, and they get to know us pretty well. Other things we use is just like a knee cushion. This piece of apparatus is called a breastboard, and so patients would lay on this, and we can elevate it to, can you see that? We can elevate this to different heights. So depending on if we need them very upright, or we can lay them flat, or we can just have a slight elevation, depending on what we need. Again, this is just something to go under their knees, and then we have various headrests with different degrees of firmness. So this particular one, you can see, includes the shoulders. And so for this person, we really wanted them to be held very still because they must have a cancer somewhere in their head and neck area, so that we can reproduce that setup every single day. Some of the other things we have, again, this is similar. So this is just for the head. This is called a thermoplastic. So therm means heat, and then plastic, obviously. And actually, to make it, we put it in this very oven right here, and we heat it up to a certain temperature, and it becomes very pliable. So it starts out flat and hard. We heat it up, it becomes transparent and soft, and then we would place it over the patient, and it becomes form-fitting over the patient. We also may treat someone prone or on their stomach, and so this is something to aid them in feeling a bit more comfortable. They'd have their face down in the hole, arms up around their face, and it just assures them, or assures us, that they're in the same position every day. These are various headrests. We call them TMOs. So this is various shapes and sizes and colors, indicate heights and shapes of the headrests. This is a wedge. This is used to modify the beam. So you can see this is actually very heavy, and it's thicker on one end than the other. So this is the heel, and this is the toe of the wedge. And you can appreciate that if I had a radiation beam entering here, less of it would get through here, and more of it would get through here. So it changes the shape of the radiation dosimetry. This just shapes the beam. So if I can only create a square or a rectangle, things like this then further shape the beam to conform to the tumor that we're interested in. This is called a compensator, and this again would be milled to a specific patient. So this is for a single patient, nobody else could use it. So this one is actually fitting on someone's nose, and it's going to fit and accommodate their face perfectly, and it's going to account for not only the change in shape between your nose and your cheeks, but it's also going to accommodate for the change in tissue densities, because you have sinuses back there that have air in them, and that's going to be a different density than the bone, right? And then finally we have something called bolus. And if you could feel it, it feels pliable and kind of wet almost. And so it is considered tissue equivalent material. So again, our bodies are made mostly of water, and so this is essentially a water equivalent. And so we use that to boost the dose to the surface of the skin. So if we're treating a scar, for instance, it would increase the dose to the skin. And then finally, I just wanted to show you, even though we don't have an actual linear accelerator here, this is actually what the treatment console would look like. And this is where we would put in a key and turn it to the right and actually beam on. So this is what the therapists interface with at the console when they're delivering the treatment. And that is a good overview, I think, of our new equipment here, and just a good overview of radiation therapy.